Hello everyone, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking of a very important learning condition called dyslexia.
It's not something that goes away. This is a child who sees letters swimming, numbers hopping.
Do we have enough special educators? Do we have enough training to these schools of how to identify and then how to find that switch outside?
25 years ago, when I would get patients, they would be like, why are you labeling?
Can parents be equipped to become educators?
Assess the children, assess the change, and then give them a diagnosis. A child who's in grade 6 would probably read grade 4 or below. When it comes to writing, I don't know what happens in the exam. But personally, I prefer using the word differential ability.
It's beautiful.
Einstein was said to be dyslexic. I mean, what better example do you want?
It's a brilliant example. I'm so glad you mentioned that. We don't have accurate prevalence data, but there are about 5 to 10% children who have dyslexia. To educate us on this topic, I have a lovely doctor with me today, Dr. Alka Subramanyam. Dr. Alka, thank you so much for joining us today. And this is a complex topic, so you'll have to really explain it in layman terms.
Thank you, Namita. Thank you for having me here today.
Our pleasure. I'd like to start with the very basic question, Dr. Alka. How would you explain dyslexia in absolutely layman terms?
So dyslexia per se means difficulty in reading, all right? So children who have difficulty in reading as compared to their peers and what we professionals call as 2 standard deviations below. That means a child who's in grade 6 would probably read grade 4 or below.
Right.
To give you a very, very simple example why this happens, all right? You have lights here.
Right.
Okay. If I were to switch on, you have 2 lamps, right? If you were to switch on the lamps, where would you switch them on from?
Right there.
Right there.
Correct.
What if one of these 2 lamps did not have the switch over there, but the panel was in the other room?
Okay. Would be
Is there
harder to get to it.
But you could still get to it
Yes.
and switch it on. Is there
Absolutely.
something fundamentally wrong with the light?
No.
That's exactly what dyslexia is.
My God, that's beautiful.
The wiring is different. I won't call it faulty, which is often used terminology.
Right.
It's different. In order to make it switch on to light up, we have to teach differently. So the switch is elsewhere. But the light is good. It functions well. So these children fundamentally have great intelligence.
Right.
We just need to find the switch to make them
My
right.
God, thank you so much. I didn't know where you were going with this lamp example, but I will never forget this example. And I think that's exactly what we wanted to understand this in layman terms. You spoke about reading, right? I've heard that they also have trouble with their spellings and ability to write or organize their thoughts while writing. So is it all 3, reading, spelling, writing?
So specific learning disorders encompasses all 3.
Right.
It's dyslexia, which is difficulty in reading. There's dysgraphia, which is difficulty in writing, which includes the spellings, the grammatical errors, the construction of sentences, writing long answers. And there's dyscalculia, which is difficulty in mathematical operations and understanding the language of maths.
Right.
So these 3 primarily form the cluster called as specific learning disorders.
Right.
It is not necessary that every child has all 3. You could have a combination of any of the 3, but whichever it is, it does need help and intervention, and it needs some sort of, school intervention as well as provision so that the child can blossom and go ahead.
Absolutely. And, you mentioned that most of these children don't have an issue with intelligence or laziness, as is often the myth. In fact, most of them have very good intellect and some of the most creative people. So is that an accurate statement to make?
So when we say that they're creative, it's not necessarily they're superlative, but it is not that they are children who are incapable. So the movie Taare, Zameen par.
Yes, best example.
Yeah, right? He became our role model at that time. And what that movie did was much more than what we had done in 15 years of teachers training to just get across to the masses that this is a child who sees letters swimming, who sees numbers hopping. This is exactly what the dyslexic brain is.
Correct.
And in order to surmount that, there's a special type of education called as remedial education, which when offered to the child, they understand things better That's the switch which makes them work.
Absolutely. So what causes this? Is someone just born with a certain type of brain where they're born with the inability to read well, or something it just can develop later in life?
So these are all under the ambit of neurodevelopmental disorders where there is aberrant neurodevelopment. You've had autism and ADHD on your shows before. This is one of the triad, where due to certain genetic conditions and changes in the macro and micro environment in the uterus, there are changes in the brain development as the child is growing. And because of this neurodevelopmental condition, it's not something that goes away, but it is something that we can, surmount, which is why the word disability is something which is used, or disorder is used, because within the medical and the legal frameworks, we need to offer help to these children. But personally, I prefer using the word differential ability.
It's beautiful.
Because these children are children who are different, but they are not incapable or disabled from a point of view that they can't do anything. Their abilities are differential. It's for us to find it. Now, not to say that all creative fields have children with dyslexia, but you would often find people who veer towards the creative fields are the ones who are like, I just couldn't do the reading, writing in school. And this became so much easier. And they could hyper-focus in the creativity and it just opened
And that's how it happened.
And many of them are brilliant, yes.
Absolutely.
So Einstein was said to be dyslexic. I mean, what better example do you want?
It's a brilliant example. I'm so glad you mentioned that. Can we talk a little bit about what are the signs and symptoms and then how do you treat it?
So typically till the child is about 8 years of age, and our law also mandates that we don't test before 8 years of age. But till 8 years of age, school and curricula are very simplistic. So you have match the columns, MCQs, things like that the child can get through. The minute you go to grade 5, from grade 4 to grade 5, you start having answers which are longer. You start introducing word equations in math. And that's when you start finding this child who is getting a grade A in 4th grade suddenly starts dipping. Right? What the teacher will typically find is that this child is able to orally tell me everything, is very intelligent, seemingly otherwise. But when it comes to writing, I don't know what happens in the exam. Right? So in olden days, it was thought these are lazy kids, these kids just don't try hard, punitive treatment would help them. And then slowly, as we went on and realized that there is a separate section of neurodevelopmental disorders called specific learning disorders, which needs intervention.
And so what are some of the things you can do to help these kids in terms of, like you said, the switch that's outside, in terms of better teaching tools and assistance?
So education has, certain paths and ramifications. So the normal B.Ed curriculum that we have is what gives rise to teachers who teach in regular schools. But when you go forward and specialize, you become a special educator. And special educators are trained to use techniques which help these children. So like I said, these children have difficulty in the regular reading and writing. So you use a multisensory approach. So you use visual, you use auditory, you use kinesthetic, you use tactile to teach them. So you can write words on their skin, you can use sand techniques. Then you use something called as mind maps, which we use for even, other children all the time. So for example, if you want to write an essay on, say, global warming. So the child will put global warming in the center, and all the topics that he wants to cover in that would be like a spider map. And then they can write it much easier because they organize themselves and they're able to approach that rather than having something where I'm writing and I'm having spelling mistakes, grammatical errors. I'm going to give you a little example, and maybe you should read this for yourself, because
we came out
with this book in 23 but got published. This is by the 75th year of the Indian Psychiatric Society, and I brought out, this is my little baby.
Congratulations.
But it's a multi-author book on specific learning disorders, the first of its kind in India. And Namita, I want you to read this. I'll tell you why.
I always like summer because of the holidays. I do a lot of drawing and going outside. It's pretty nice going out in summer, like have a hot day and eating ice cream. But sometimes I do hate summer because when it is so hot, I starting to severe and getting tired, but all the true summer month is pretty fun. I was working on my drawings and paintings, and of course, after my homework, I go outside to play, and some fun with my homes like gaming and playing football. It is pretty fun. So I noticed quite a few spelling mistakes, which I was trying to understand and read at the same time. So I get what you're, because it's saying I starting to sever, sever.
Right? So maybe
Right.
I was starting to shiver or tire. Now this text that you're seeing with so many errors,
Right.
which Namita found it so difficult to read.
Yes.
That's
I did.
exactly how the child finds it difficult to read when they have dyslexia. This is the same child who has made this painting.
How
Same
beautiful.
child.
How beautiful. Lovely.
Look at the differential ability. Right? So we had a tough time convincing the publishers that this is the book that we want with this cover to show exactly what we are trying to say.
Amazing.
So they have these errors, and through the multisensory approach and through the special education, we correct that. So this is a very good resource for those in the field and who want to get it.
Can I have the book? I love reading. So rest assured, this will be read page to page because this is fascinating. And does this only include the 3 forms of dyslexia that you spoke about?
Yes. So
Or does it have other conditions as well?
no, this is exclusively for dyslexia.
And I'm so glad because I think it's a condition with a prevalence of 5 to 10%, very large number, that deserves
Yes.
not to be mixed with other topics, and a podcast of its own and a book of its own.
and help of its own. So the government has measures whereby we assess the children and we give them provisions at a school level, which is also mentioned there.
Right.
There is a lot of debate on this because the newer diagnostic systems say that we should actually have something called as response to intervention, which means there should be a special educator in school, assess the children, assess the change, and then give them a diagnosis. With our population, you just said 5 to 10%.
Right.
Let's assume there are about 48 crore children.
Very large number then.
How are we going to do it? We don't have the resources.
Right.
So we go back to the system where we assess their IQ, and based on the discrepancy model, that can they do it or not, we award them the diagnosis.
And in fact, that's a very basic question that, like you rightly said, with that large number and a lot of government schools, do we have enough special educators? Do we have enough training to these schools of how to identify and then how to find that switch outside to help them?
So in terms of identification at a school level, the Sarva Shiksha Abhiyan has a screening checklist.
Okay.
We have indigenous tools like the DALI, that's Dyslexia Assessment of Languages in India, which was developed by
Where
Nandini.
is this tool available?
Nandini Singh. It's available online. It's from Delhi.
Okay.
So Nandini Singh and colleagues, she's also there in that book. So we do have systems for assessment, but we don't have that many centers. We don't have that many special educators.
Right.
And the Indian tools which we have are not that evolved. So even at our center, so at Nair Hospital, we run a dyslexia center since 2006. And we use a foreign tool which is accepted here. But see, the limitation is that for vernacular languages and tapping children across that,
Right.
we have a little limitation.
Can parents be equipped to become educators through very simple terms and methods that they can, if there aren't those kind of educators available at government schools, maybe parents can learn some of the techniques to help the
A
kids?
lot of parents do. So in terms
Where
of
is that available?
helping, so SNDT offers special education.
Okay.
And there are courses which are run, even Umeed runs courses, shorter courses for parents to help their children.
Okay.
So that is the remedial education part of it. But still the diagnostic part of it also, we are struggling as a country. We are much better off.
Right.
There was a PIL by Dr. Harish Shetty a few years ago, and then we have assessment centers across at least Maharashtra state. But we don't have the personnel yet.
Okay.
So we are in a stage of evolution.
Right.
Fortunately, now acceptance is not that much of an issue. Like 25 years ago, when I would get patients, they would be like, why are you labeling? This
Correct.
word label is a very big thing.
Correct.
But I always tell them that if you have a child who has spectacles, will you tell the child, sit in the front of the class, don't wear your spectacles and read? Would you ever deprive a child of that?
correct.
So where is the label?
Correct.
People call children with spectacles chashmish too. We have to keep that aside and see what is best for our child and go forward.
Absolutely. No, I mean, so beautifully explained. I think we've covered all the questions that I had, but is there anything more or any parting words that you'd like to leave our audience with?
I think that it's very important to understand and realize that children, particularly on the dyslexia spectrum or with specific learning disorders, are very capable young individuals. And it's very important for us to form a group of such individuals, because I think they can be motivators for others, and I think they can set the torch to see that dyslexia in India reaches the next stage.
Dr. Alka, I'd like to know a little bit more about how is this developing on the global front? What does the government do there versus what it is that we can do in India to catch up?
So, Namita, this is going to take a while to explain, but the
do.
thing is that the global scenario is extremely different. Every school has someone called as an educational psychologist in school when you're abroad. And it is that educational psychologist who actually does the assessment along with the special educator at the school level. So each child gets what we call as an individualized education plan,
Right.
the IEP, at the school level, and the school implements it and gives whatever help they need. Now, in our country, cut to India, we don't have educational psychologists as a designation or as a degree at all.
Oh,
Okay, so we have special educators,
right,
and we have psychologists.
right,
So these special educators are the ones who are trained at either diagnostics
right,
or remediation,
right.
right? So what the government has done is said that through specialized centers like ours, where psychiatrists, psychologists, special educator work in a multidisciplinary team, you diagnose the child, you say that the child has needs for these provisions. The provisions are given by the board. So SSC board has its own, CBSE, ICSE, so on and so forth.
Okay.
But the diagnostics is done at the medical level.
Oh,
Whereas there, the diagnostics is done at the school or the community level.
understood.
How do we bridge this gap? With us, again, we come back to our population. So maybe this won't go away. But what I think we can do is that there's a national education policy 2020, which is coming, which is talking about teaching children in their mother tongue, inclusivity, so on and so forth.
Right.
I think as a thrust of that NEP, it's important for both center and state governments to really ensure that we have special educators in school. Why would that be? If you have one or two educators, say in a school of 500 or 1,000 children, those educators can be nodal educators to teach class teachers.
Right.
So what you're doing is a ripple effect where the teachers, the nodal teachers, will teach everybody else, and thereby you can give classroom concessions and provisions for these children, which is so much needed.
Understood.
Which we don't have.
And globally, probably this is all funded by the government.
Everything.
So I think that is the other thing. It's also a question of, obviously everything cannot be done with the private sector, especially in the interiors or for the not so fortunate. So can the government really put in resources to get this army, literally, I can't even say team, army of special educators in place at each and every school to have the diagnosis and the assistance at a school level rather than coming to a medical center like yours? And how many such medical centers even exist in India? Not too many, I'm thinking.
Not too many, not
Right.
too many. Although we do have most of the medical colleges now equipped to certify, but they still don't have personnel to carry out the kind of testing that we do. We do
Right.
very intensive testing at Nayar Hospital, right? So what I really think is that funding is one thing, but the budget for education and for teachers, a satisfied teacher will give rise to a satisfied generation.
Right.
Because if I am teaching to my best ability and I'm not relying on teaching you outside the school, which is a very big thing. And I think teachers are people who are very motivated and want to do that as a profession. So
Yeah.
teachers, police officers, these are the people we should, doctors, of course, we should, the ones we should always
Absolutely.
reward.
And empower more.
Empower
Yeah.
monetarily also. So if they're
Monetarily also, yes,
If they're
yes.
financially satisfied, you will see the Finnish government, look at the Finnish education system, look at the Japanese education system. These are role models for us.
Yeah.
And they have a bunch of satisfied teachers.
Right. Absolutely. No, it's so beautifully said. And I must accept that when I came at the beginning of this episode, I didn't know much, and Google doesn't do justice. So I would highly recommend that all of you buy this book. I would highly recommend that we all do a little bit to spread awareness. and to make sure that we equip more and more schools and more parents who need this with the right diagnosis tools, with the right education tools, so that these lovely children, like Dr. Alka so beautifully explained, it's just that the switch is outside. There's nothing wrong with a lovely lamp. So can we just make sure that they're these beacons of light and shine beautifully for the world, because they deserve that. Thank you very much.
Thank you, Namita.